All right, good morning, everybody. Welcome to our webinar today. Today's webinar is on dental programs, some new dental programs that we have, as well as other dental changes. And we have those two topics for you today. We'll walk you through it. Today's webinar is being recorded and will be posted to group site. So feel free to review it or share it with your colleagues. Before we get going, I don't have an introduction slide, but I actually would like to introduce our organizers and our presenters. The first person who is not here is Crystalline Franklin. She's on our policy team, and she will be talking to us about the new dental programs, or she would be, but she is on jury duty, so I am presenting for her. But we have some other folks who can help answer questions in the background. So Tanya and then Christina, can you say hello as part of CPOP?
Good morning, everyone. My name is Tanya Curiel, and I am a Regional Outreach Coordinator on the CPOP team, and I serve the Central Oregon region.
And hi, everyone. My name is Christina Hernandez, and I'm also a ROC on the CPOP team, and I serve Southern Oregon.
Great. And Christy Taylor is here for answering any questions we might have. Can you say hello, Christy?
Good morning. Yes, I'm Christy Taylor. I'm with Medicaid eligibility policy and work in the one system. I know some about the changes we're making. Crystalline has been our lead on these topics for the most part, but I'm very familiar and I hope I can answer any questions that may arise.
Thank you for being here. And then we have Jessie Wilson.
Good morning, everyone. My name is Jessie Wilson, and I am the CCO Services Manager in the CCO Operations unit in HSD. Thanks for having me.
Thank you. And Jessie will be presenting the second half of this webinar. Right. So we are going to be reviewing today first two new dental programs. One of them is for veterans, and the other one is for COFA community members. COFA is the Compact of Free Association. If anybody does not know what that is, we can explain it in the chat box. All right, and then, we are also going to be explaining upcoming changes for some members who are currently receiving dental through what's called a dental care organization. Many members receive dental through a dental care organization, and there's some changes for some of those members, and we will outline exactly who that is. And then we'll have plenty of time for questions and answers with our subject matter experts who are here today. Right, we'll get a little bit into COFA in just a minute, but Crystalline is our policy team lead on this, and we have two new programs. So beginning November 1st, and actually beginning today is when it is first showing in the applicant portal. ODHS will begin accepting applications for these two new programs. The first one is for veterans. So this is different than regular OHP. This is just dental, and it is for folks who are not eligible for full OHP. It is a program that opens up eligibility for dental only for more individuals because we know it's needed for these populations and we've been able to offer it. So somebody must be a veteran, and we'll talk about the eligibility criteria in order to receive this veterans dental. The other one is dental only benefits for COFA community members, Compact of Free Association. That is folks from Micronesia, Republic of Palau, and Marshall Islands. And it's for folks who are not eligible for full OHP benefits. We've added this extra program so that if they're not eligible for full OHP, they might at least be eligible for dental benefits. And those benefits will begin January 1st, 2023. A little bit of background is that some bills passed in the 2022 legislative session. House Bill 4095 and Senate Bill 1538. We have put links there for your reference. We won't go deeply into that at all, but we thought you might want to know that the veteran dental is funded by lottery funds, and the COFA dental program is funded by general funds. They are not full Medicaid, but they are part of the Oregon Health Plan benefit package. So they are Oregon Health Plan, but they are a very limited benefit for dental only. And in fact, they are the last programs on the medical program hierarchy. So many of you may know that we have more than 60 programs or 60 medical programs programmed into the one system. And we go through the hierarchy and we try to give people the programs with the richest benefit first, and then we go down the line. And at the very, very end, if people are not eligible for any of those, but they meet the criteria for the veterans or the COFA dental program, then they can get that dental only OHP benefit. The way to apply is just like you apply for any other OHP medical program, which is through the one system. Of course, people can do it also with a paper application or a phone application. It's just the OHP application. And within that, we will evaluate people for all those programs. And if they're not eligible for the others, we might find them eligible for dental. And in fact, one of the criteria is they must be found not eligible for full OHP and meet the specific requirements for these two dental programs. So I think it's really important. We're going to keep saying it. I might sound repetitive, but individuals must apply for OHP and then be not eligible for full OHP in order to be evaluated for these dental only programs. Before we move on to the details of the two of them and the eligibility factors, do we have any questions or comments to bring into the larger space?
Don't see any questions in the questions box yet.
Okay. So let's talk about the veteran dental program requirements. And again, it's dental only. The requirements are that somebody must be not currently in the military, so a veteran, not currently serving. They must meet the definition of a veteran, except, and this is a big one, they can be discharged or released under any conditions. So they can even be discharged under dishonorable conditions and still be eligible for this dental program. This dental program is available for individuals all the way up to 400% of the federal poverty level, and they must reside in Oregon, and they must be not eligible for the other Medicaid programs. They can have Medicare savings programs to help pay for their Medicare, but they can't have other Medicaid medical coverage. There are going to be some changes to the veteran information screen in the One Applicant portal, and those are launching today. What you'll see starting today on the veteran screens is additional text about dental coverage. And this is how we know if they meet the definition of a veteran that applies to this particular program. They can always say don't know or decline to answer if they need to. Let's see. There's also a new question, which is, was this person ever full-time active duty in the U.S. Armed Forces or National Guard? That question will only appear if they answered no to the first two military questions, but it's to make sure we are evaluating everybody that might be eligible for this program. There are also some changes to the report a change screen. There's a new checkbox for someone in the household has a change in veteran status. Now, the reason you might want to, so this is how somebody who already has OHP, but might want to make sure that they are in the queue for this program, should they lose their OHP, they would want to go in here and well, this is actually sorry, I'm getting confused on scenarios. If somebody has a change of veteran status, for example, they retire from the military and they become a veteran, then they would want to report that because that could make them eligible for this program. If they're currently on OHP with full benefits, they will not be eligible. But if we have their accurate status in the one system, What it means is that if they then have a change in circumstances and they become not eligible for OHP in the future, we will know that they meet the criteria to be evaluated for the veterans dental. So it would be important to report this change even if somebody currently has full OHP and dental coverage, so that they have more options available to them in the future. In fact, we have something called a veteran dental reservation list that we are creating or will be creating. And right now we have limited funding. Our funding will only cover this dental program for about 3,000 individuals. We don't know how many people are going to apply, but we are writing into the One System or programming into it the concept of a reservation list, so that if the funding is depleted and we find that there are people who would be eligible, but we don't have funding for them, they will automatically be placed on this veteran dental reservation list. And that reservation list will then be gone through on a first come, first serve basis, like whoever applied first, to allocate that additional funding to those who are eligible and on the wait list. All right, so that is the summary of our veteran dental program. I'd like to pause and see if we have any questions or any comments from our organizers. I'm not hearing any questions right now, but you may have some, and we're happy to answer them. Is that right? There are no questions? Right. I'm going to open the questions box just to be sure. Are individuals without a legal status able to apply? That's a great question.
I'm obtaining a concise answer to that if I can, but Crystalline, we may need to wait for Crystalline.
Thank
By
you.
virtue of being in the military, I think that may be qualification, but I need to double check.
All right. And we have some additional questions about being in the reserves. Is that also a question for Crystalline?
Yeah, let me double check on that.
Okay. And then I think there's also a question about how long this coverage would be for. Is this, my understanding is that it's ongoing, but do we have any details about that?
I don't, I'm sorry. Good questions.
Okay. We knew that was going to happen. Crystalline is, she's fulfilling her civic duty on jury duty, so we completely understand, and she will be able to help us afterward. She may actually be watching her teams, so Christy, if you wanted to send her individual teams a message about these questions, she may be able to answer. We may be able to get that information before we finish up today. She invited that, so if you could take care of that in the background, that would be wonderful. All right. I just want to take a moment to say here that because this veterans dental is for individuals up to 400% of federal poverty limit, and adult full OHP only goes up to 138%, that means that if a veteran becomes over income for OHP, there is quite a large leeway there, inside of which they may be eligible for the dental program. Now, they don't have to already have been on OHP and lost it. If you have somebody who's a veteran who has a higher income but under 400% and they need dental benefits, they can apply. They would just go through the full OHP application, and at the very end it would say you're over income for all of our other programs, but you are within income range and eligibility for dental. So it's just the regular OHP application. Right. I'm going to move on to the COFA dental program now, and we'll continue to answer questions later in the chat box as we're able to. All right, so COFA. COFA community members are individuals who are here under what is called the Compact of Free Association, and they are individuals. This Compact of Free Association agreement is with the Republic of Palau, Micronesia, and the Marshall Islands. And if people are here under under this COFA agreement, we have some time ago opened up full OHP benefits to them if they meet the income criteria. But we have also opened at the same time concurrently opened up a dental program for them. And so even though as of December 2020, these COFA community members of any age now meet the non-citizen requirement for full OHP, meaning that is a qualified immigration status or qualified non-citizen status to get full OHP. So many of the members of the COFA community have full OHP, which includes dental benefits. But we wanted to be sure that even those who don't qualify for OHP for a number of reasons might still have dental available to them if needed. Now, because so many members are eligible for full OHP, which includes dental, we don't expect many individuals to be enrolled in this dental only program. So our estimate is about 250 individuals statewide. So this is not likely to be a widely used program, but it is here. You can think of it as a safety net dental program, and we'd like you to understand how it works. It has different criteria than the veteran program, and it will provide dental coverage for individuals with COFA status in the one system and who have income at or below 130% of federal poverty limit. So they're going to meet the income criteria for OHP, but this will be particularly helpful for those who don't meet the other non-financial criteria for Medicaid. And we'll walk through who that might be in just a moment. The most likely people to have this program be available to them and useful to them is individuals who are over 65, so they wouldn't be eligible for the MAGI OHP under the 138% of federal poverty limit. If that was gibberish to you, don't worry about it. But individuals who are over 65 have different criteria for OHP. And they have a lower income limit for the most part. So if they're not a caretaker of a relative who is a dependent child, meaning they're not eligible for the PCR program. If that doesn't make sense to you, don't worry about it. But if they're over 65 and they can't get onto OHP because they're taking care of a dependent child, and they can't get onto OHP because they're over income for the program that would be available to them being over 65, which is OSIP-M, they might actually have, let's say, 120% of federal poverty limit could be their income. That would not get them OSIP-M, and so they would not be eligible for full benefits. But they're still under that 138, which is the limit for this program, so they could get dental. So it took me a while to wrap my head around that. I'm guessing all of you, many of you are sitting in trying to understand that. But basically, under 138% and not eligible for OHP for whatever reason, they could get dental. Now, the other group is individuals who are under 65, but they are not eligible for OHP because they're not providing minimum essential coverage for a dependent child in the home. So as a reminder here, adults can only be eligible and get OHP if they are providing for their children, if they have children. If they're not providing medical for their children, then we can't give them full OHP. So if there are any COFA community members in this situation, they would be eligible for the dental only. I'd like to pause and see if we have any questions about this, because there's some brain gymnastics going on here.
I don't see any questions about the COFA dental program yet.
Okay, then we'll keep going and we'll see if any pop up. Thank you, Christina. For these two programs, we have different types of verification that are needed in order to give them benefits. So for COFA, the COFA dental, first individuals must have COFA status and indicate that in the One system. Those individuals will be automatically evaluated for this COFA dental program if they are denied for full OHP benefits. But beyond that, we do not verify immigration, so in order to get this benefit, and we don't verify income. So really the bar is having COFA status and indicating that in the One system, and then being under 138% and not eligible for full OHP. For veteran dental, it's a little bit different. Veteran dental does require some verification. If people can't provide that verification at first, we still give them benefits, but their verification will be due at a certain time, and so that's called a soft pend. We give you benefits, and you just have to provide all your information by the due date in order to keep your benefits. So what we need for veteran dental is we need verification of income. And that's actually after the COVID PHE, right? So during the COVID public health emergency period, we are not requiring verification of income, and that applies to this population as well and this program. But after the COVID PHE ends, we will need verification of income if the One system cannot verify that income. And we would need that on a yearly basis, potentially. We will also need verification of discharge to verify that this person is no longer an active military member, that they are actually a veteran, to make sure that they meet the requirements and the definition of a veteran. And they'll need that to retain ongoing eligibility. So we do have a link here of acceptable discharge documents. We're not going to go into that detail, but we provide it so you can access it later. Here's the timeline. New screens.
I was going to say, Deanna, can we go back to the last slide, because there was a question about that one in the chat.
Absolutely.
And the question was, does the second requirement apply to all OHP applicants or just the COFA community?
I can take that. I hope this is what it was referring to, was the second bullet under COFA that says no immigration verifications required. If that's the case, if that's what you're asking about, again, the full Medicaid determination needs to be made first, and that does require a verification of immigration status first. So the implication is it wouldn't hold up if we don't have that verification. It wouldn't necessarily hold up an evaluation for the dental program if we don't have it. But first, we have to be able to make a Medicaid determination.
So it really should be no additional immigration verification required.
And I just got clarification from the person saying that they were actually asking about the slide previous to this one. So the second point in the slide previous to this one. Sorry about that.
Can you reread the question, Christina?
Yes. So it was, does the second requirement apply to all OHP applicants or just to the COFA community? And she said it would be the very bottom, so the very bottom one. So individuals under 65 and not eligible for OHP because they are not providing coverage for a dependent child in the home.
Right. That is a requirement, providing coverage for any dependent children in your home. That is a requirement for all of OHP eligibility, as far as I know. Can we get that verified by policy? Maybe Christy?
I'm confused. I'm so sorry. I'm confused on that question.
I think what the question is, if I interpret it correctly, is there a requirement for all OHP programs to provide medical coverage for dependent children in the home in order to be eligible for all of our OHP programs, or does that only apply to some of them?
Oh, I see it. It's only some of them, the Magi Adult Program.
Great, thank you. Okay, and I'm going to keep going here. The timeline for these two new dental programs is a little bit staggered. Maybe that's not the right word. I'll just walk you through it. Starting today, new screens and questions went live in the One system. It's actually just new questions. And you will start to see those. However, Because these programs don't start until January 1st, 2023, people will not get benefits until later. But you can start answering those questions with people in the One system right now. Interestingly, the eligibility for these programs won't actually open up until December 1st. So on December 1st, One will rerun eligibility for all of those individuals who applied between October 26th and December 1st. So you will not see eligibility for these programs at all in the One system until December 1st. And whoever is eligible starting December 1st and going forward can get benefits beginning January 1st, 2023. So I want to make sure that makes sense for folks. So you will see these questions, but you will not see eligibility until December, and you won't see benefits until January.
And can I add some emphasis to that, just to add? What that means is that you'll get a denial for these folks in October. Don't worry, like still apply and get your name kind of on the member's name on the list. And the denial itself will hold the place, if you will, in the system so that we know which ones to rerun eligibility for in December and get them enrolled. Does that make sense? So if you want someone to be considered, there was a question related to this in chat as well, and which I appreciate. Let me take a minute to go over that if you don't mind.
Yes, please.
Yeah, they asked if someone recently applied but got denied and they were a veteran, will they automatically be put on the, be considered, or do we have to reapply? And you do need to reapply because One hasn't collected their information yet. Or their verification yet, and it's not considering the eligibility because technically the program doesn't open for enrollment until January. So reapply, get the denial in October or November, and then hold on because we'll rerun that eligibility later and get them enrolled.
Terrific. Any other questions before we move on to what CPs can do to help? Which is very related to what we were just talking about. All right, if we do, I'll trust you to chime in. So starting today, these new questions will be live in the applicant portal, and you should help applicants answer these new optional questions. Now, the questions are optional, but nobody will be considered for these programs unless they answer the questions. So please encourage people to answer them. Now, they should answer them even if you think they're going to be eligible for full OHP, because again, if we know what their status is, then we can evaluate them for dental only if they should lose their OHP in the future. And as Christy was saying, you can also help identify and assist individuals who were previously denied for full OHP. If they are a COFA community member or if they're a veteran, you should help them reapply because they might be eligible for the dental. And if somebody comes to you and says, oh, I already applied and I was denied, I'm not eligible, you can really encourage them to apply again if they're a veteran or a COFA community member, because they might have this new program available to them. And within this new program, NEMT, that non-emergency medical transport, is also covered if it is covered for dental services. So any service that's covered under this program, that dental only, they can get NEMT to those appointments. Right. We have a new topic coming up, so let's pause and see if we have any follow-up questions or last-minute questions about the dental programs. The new dental programs for veterans and COFA community members.
There was a question that says, are individuals under age 65 with a disability that qualifies them for Medicare eligible for the COFA dental programs as well?
Christy or Jesse, would you like to chime in?
Can you repeat that question, please? I want to make sure I got.
So are individuals under age 65 with a disability that qualifies them for Medicare eligible for the COFA dental program as well?
So I believe they're going to be considered for the full COFA coverage at that point. They wouldn't necessarily fall under the dental only population because they could still be considered under the full COFA program.
But the answer is yes. If they have Medicare and they, for some reason, are not eligible for full OHP, then they could be eligible for this COFA program, this COFA dental only. Right. Should we move on to our next topic? I'll take that as a yes. All right, so if you all thought that that was not enough mental gymnastics for you, then we have some more. This is, we're gonna have Jessie Wilson, and I will let Jessie reintroduce herself. But we're gonna be talking about upcoming dental plan changes. And I will be honest, it took me a while to really understand this. And we worked really closely with Jessie to create these slides and with Christy Taylor. And Jessie will present, and I may chime in if I feel like there's any questions that I want to channel from community partners that aren't in the chat box, or any clarifications. But Jessie is really the expert, and she's been helping us understand this program. She's been helping us understand this change. And so I'm going to pass it on to Jessie to introduce herself again and lead us through what is happening and what you need to know as community partners.
Great, thanks, Deanna. Jessie Wilson here. I'm the CCO Services Manager. A bird just flew into my window, so that scared me. That's why there was an awkward pause and a loud noise. Anyways,
I heard that.
Did you? Yeah, it flew right into my window. David, my colleague David Ballantyne, some of you may be familiar with him. He is not able to join us today. So if there's any questions that would be really geared toward what he is the expert in, then we may have to follow up. But hopefully we'll be able to answer everyone's questions today. But I'm here to talk about the upcoming dental plan changes for some OHP members. So this next slide here is just an overview. I'd like to set the stage first for what the current model is. So currently, both OHA and local CCOs contract with dental care organizations, or DCOs. Effective January 1st, so moving forward from January 1st of 2023, the state will no longer contract directly with the DCOs. So members in DCOs through the state, those state-directed DCO members, will transition to DCOs contracted through their local DCO. So I want to point out this change impacts approximately 69,000 OHP members. So we're talking less than 4% of OHP members. These are mostly individuals who are on fee-for-service for medical, but they are enrolled in a DCO for dental. And then that 69,000, that less than 4%, that is the focus of this presentation. And I wanted to point that out because there are current OHP members that do receive dental care through DCOs that are contracted with CCOs. So that is a different population. We are specifically talking about the folks who are with DCOs through the state. And if that's confusing, hopefully the next few slides will clear that up.
Yeah, I would like to get a read. How many people feel confused right off the bat? I did. But we've worked on how to communicate this, and I'd like to know how we're doing. So if you can give me a read in the questions box about your level of understanding so far, just about these DCOs that exist in two places. A couple people are confused. A number of people are confused and not understanding questions like, what is a DCO?
Okay, we'll get into that.
Okay, so hang tight. I want to check in a few more minutes and see if we can pull you in, but I will take a moment to reiterate what Jessie said, which is that just like a health plan, you might be enrolled in a health plan like Kaiser or Providence. It's like a network that's responsible for your care. Some members are enrolled in a network just for their dental. It might be Advantage, let's say, or I forgot the other names. Let's just say it's Advantage Dental. It's a plan with a bunch of providers. They take care of your dental, and that's what a DCO is. That can exist under the state, for like commonly for fee-for-service members who are on fee-for-service for medical, but enrolled in this plan for dental. But that can also happen over on the CCO side. If you're enrolled with a CCO for medical, you likely also have a DCO, a dental plan, like Advantage, and you have to go see somebody who contracts with Advantage. So the first thing we wanted to do is just clarify that there are these things called DCOs, these dental plans, but they exist in two different places, over at the state and under the CCOs. It's basically a CCO, but for dental, yes. And so that's the first piece of understanding we want you to have in order to understand these changes.
Thanks, Deanna. So what is a DCO? So Deanna touched on this a little bit, but DCOs are Oh, go ahead.
No, I just said oops because I was ahead of us.
Oh, okay. DCOs are dental plans that are responsible for helping OHP members. So they help navigate their dental care, understand their benefits, and find a dentist. And then each dental plan has a network of dental providers they work with. So the DCOs contract with dentists, and that makes up their provider network. And so as Deanna mentioned, there are these DCO, so these dental care organizations that we have in Oregon. I believe there are 8 off the top of my head. I think there are 8. 5 of those contract with the state, with OHA, but they also contract with CCOs. Okay, so this slide gets into that a little bit deeper. So currently OHA contracts with 5 of those DCOs that manage the care for the 69,000 OHP members. And those members do not have their dental care facilitated or coordinated through a CCO or through fee-for-service. So the 5 that currently contract with OHA are ODS Community Dental, Advantage Dental, Capital Dental Care, Managed Dental Care of Oregon, and Family Dental Care. So most coordinated care organizations also contract with those DCOs or with dental plans to manage their members' dental care. The only 2 from the list that I previously just mentioned that don't currently contract with CCOs are Managed Dental Care of Oregon and Family Dental Care. They directly contract with OHA, not CCOs. The other 3, ODS, Advantage Dental, Capital Dental, they all have existing contracts with local CCOs as well. And then there are a few other DCOs, Care Oregon Dental, Willamette Dental, Kaiser Permanente Dental, that have contracts with DCOs as well. But we're not talking about those because they don't have contracts with OHA. So some CCOs, as I mentioned, work with several dental plans. And if you want to see a list of those relationships, there's a link here that we've provided it's really a comparison tool. You can look at the CCO and see which dental networks that they're affiliated with. Okay, so what is changing? Well, beginning January 1st of 2023, OHA is no longer going to contract directly with those 5 dental plans or DCOs to manage dental care for OHP members. So going forward, those members, the 69,000 that are needing dental only enrollment, will be enrolled in a local CCO for management of their dental services. So we are essentially creating a new CCO plan type called CCOF. And it will only be for dental services. So if you're not familiar with the CCO plan types, which I don't think it's very common knowledge, so we'll go through this table. There are essentially 5 different CCO plan types, and those are based on the scope of coverage or the types of services that the CCO are responsible for coordinating for the individuals. So CCOA, that's where most of our OHP CCO members are. They have physical, behavioral, and dental care covered by the CCO, all 3. Members that are in CCO plan type B only have their physical and behavioral health services covered by their CCO. And then they may be fee for service for dental, or they could be in a separate DCO. Members who are in CCO E only have behavioral health covered by the CCO, and those in a CCO plan type G have behavioral and dental, and then usually have their physical health covered by maybe like third-party liability or another insurance coverage. So what we are adding is a new CCO plan type, and we're calling it CCOF, which is dental only. That will be coordinated through the CCO. I'm going to pause there, see if there are any questions or comments. How are we doing in the chat, Deanna?
Let's see. I'll read this, and Jesse, you can decide if you want to answer this now or later.
Okay.
Clients with private dental who want to go to their own dentist, they are getting enrolled with a DCO and told they have to go to Advantage Dental. Will they now be able to see their dentist? They won't be enrolled into a DCO? Private dental.
I'm confused why we would enroll them in a DCO if they have private dental TPL, basically. I'm concerned that private dental coverage may not be getting into MMIS, and so MMIS is thinking it's okay to enroll them in a DCO when maybe they shouldn't be to begin with.
Yeah, I agree, Christy.
Thank you. All right, here's the next
So what should happen, so what should happen is their private dental will be primary, and they would be fee for service for dental as secondary OHP. They would not be enrolled at all.
And they are being enrolled, so there's something going on there. So Renee, we should escalate that and take a closer look. So if you can escalate that to your RUC, that would be great. Next question. How will it be determined which CCO? Okay, I think we're going to get into this. So I'm not going to answer Susan's question here. We'll answer it later. And I think we're going to talk about tribal members as well. So let's just hang on the tribal piece. And the question is, will fee-for-service dental still exist?
Yes, it will.
Great. Okay, I think we should move on, and we'll continue to answer questions as they come up.
Great, thanks. Okay, so here is a visual to try to help understand what this change is encompassing. So on the left side of the screen, we have current state. So right now, members they'll enroll with OHP, and based on eligibility, if it's determined they're eligible for DCO, dental care organization coverage, they will directly enroll with that DCO. The DCO that's serving their county of residence. So residence determines plan assignment. Moving forward from January 1st, 2023, on the right side of the screen, the members they'll enroll with OHP, and determined on eligibility, if they're determined eligible for dental plan coverage, they will now enroll with a local CCO. So the CCO that's serving their county of residence, and then the CCO will maintain that dental network. For many of these members that we're talking about, the 69,000, this won't be a significant change because a lot of the Oregon CCOs already contract with the DCOs that OHA is currently contracting with. So it's sort of it's adding this extra layer, if you will, here in the visual, or actually, I guess the CCO is replacing the OHA structure. OHA is not having the contract with the DCOs. The CCO will. And then to help facilitate this transition of members, we are planning to share member data with each of the CCOs to help match up their incoming members to their current provider or plans. Because as I mentioned, a lot of these CCOs already have those relationships with DCOs, or they directly contract with those dentists. So we're going to match up the members so that it can be as seamless of a transition as possible for those members. Okay, so who will experience a change? So we want to make sure that we communicate this so that you all can help members understand what it means for them. So there are between 28 and 29,000 members that will not really experience any change. They are in a county that is served by one CCO, and that one CCO directly contracts with the DCO that they are currently enrolled with. So their dentist will not change. They will just transition into that CCOF, but they will be able to maintain that dentist because, again, their CCO has a relationship with the DCO. For about 34,000 members, they are in a county served by multiple CCOs. They can also keep their current dentist, but they do have an option. They can pick which CCOF they want to enroll with. So they can call client services unit and let us know which CCOF that they want to enroll with. And I think that tool that we included as one of the handouts highlights which dental networks are have relationships with the different CCOFs. So if that's a deciding factor, they can take a look at that, and you can take a look at that to see where those relationships exist, if that would be helpful in making decisions. They do need to call client services unit by the end of this year to make that selection. If they don't, then what's going to happen is we're going to assign them to one. We're going to randomly assign them to one. Again, they should not have to change their dentist because the CCOs already have those existing relationships with their DCOs. And we'll get into more about when they can change their CCOF if we enroll them in one and then they decide later that they'd rather be in a different one. I'll get into that in a different slide. Okay, so for the next category, about 4,000 members, they will need to switch dentists. And here's why. They are residing in a county that has one CCO, and that CCO does not have a relationship with their current DCO. So to help accommodate that transition, we are encouraging folks to keep any appointments that they have, and they can basically finish out any treatment or appointments they have with their current dentist up until the end of March of 2023. And then at that point, they will transition to they'll transition to the CCOF before that, but they'll have that 90 days essentially to finish any treatment. So there will be an interruption for about 4,000 folks in their current dentist that they see. And then for about 1,600 tribal members who are currently enrolled with a DCO through the state, their dentist may change. It really depends on which county where they reside. Does their county have one or multiple CCOs, and do those CCOs have a relationship with the DCO? It really depends. But I want to highlight for this population, they will not automatically enroll in a CCOF. So what will happen at the end of the year is if they do not select a CCOF, they'll move to fee-for-service dental. And then if they decide they want to opt into a CCOF, they'll need to call client services to opt in. So they are exempt from that auto assignment to a CCO. Okay, I'm going to pause there again because that was a lot of information.
Let's start with this question. How do we know who those 4,000 members are?
Great question. So we've sent letters to anyone who's impacted by this change. They should have received a letter. We sent letters at the beginning of this month. And so they will have a letter that basically mirrors one of these 4 scenarios and lets them know what is likely to happen based on their situation. So in terms of community partners knowing that, I guess that would have to be relayed to you by the members. We have lists of them, but I'm not really sure, our ability to share. I guess I would put that out as a question. Has anyone had a member reach out to them that's already received a letter?
Let's see. I see one no. Oh, some people have.
Okay.
Well, one person has. I have 2 answers, a yes and a no. We're at 50%. Has anybody Oh, somebody else has received a letter. So let us know. Keep letting us know. It's really interesting to get a read on that.
And this may be helpful. I can tell you which counties this mostly impacts. So the counties where there are gaps in CCO, DCO relationships, where there's going to be that interruption, it's Umatilla County, because Eastern Oregon CCO is the only CCO serving Umatilla County, and they do not have a relationship with all of the DCOs currently serving that county. So there's going to be interruption in Umatilla County. It's part of Klamath County will have that interruption. Part of Yamhill County, Josephine County, Tillamook County, Clatsop County, and Columbia County. So those 7 counties only have one, there's the one CCO that does not have a relationship with all of the DCOs. So any members who are in DCOs that don't have that contract with a current CCO are likely to need to switch dentists.
And people in other counties will be able to keep their same dentist.
Yes. Yes.
Okay, I'm putting that into the chat so everybody can see that.
Yeah, and it's only part of Yamhill and part of Klamath. I can follow up with more information if that would be helpful about those counties and where those gaps may exist, will exist.
Thank you, it might. So what if the local CCO doesn't have any dentists that, we might need more information about this. The question, I will just read it. What if the local CCO has no dentist? Will they get referred to another provider or plan?
If the local CCO doesn't have a dentist, well, there are different contract requirements where they need to be able to ensure contract capacity, network adequacy to be able to serve the members. If there is a network adequacy issue or a capacity issue, if there aren't enough providers, then we'll have to look at different options, like potentially fee for service, keeping that member in fee for service. Christy, I don't know if you have anything to add on that.
I don't at this time.
Okay.
It may be something that pops up and we'll have to start addressing. So I flagged it for us to keep an eye on.
Yeah.
All right. Next question. Will MMIS show the CCO for the CCOF or the DCO that the CCO partners with? So what will we see in MMIS?
Do you want to take that, Christy, or do you want me to take that?
I don't know the answer, so I hope you will.
Oh, sorry, MMIS. I was thinking one for a second. So MMIS will not show the DCO because OHA moving forward will only have a contract directly with the CCOs. The DCOs will be subcontractors of those CCOs, and so we won't have that information in MMIS. What we would see in MMIS is the CCO name for the CCOF.
So let's take the metro region, which is, or I think it applies to anybody. If somebody is enrolled in fee for service for medical, but they're on a DCO for dental, and they get transitioned over and they end up with Willamette Dental, it would not say Willamette Dental in MMIS because MMIS does not contain the plan level, but it would either say Health Share or Trillium.
Correct.
Okay.
And I am in getting confirmation from a subject matter expert in MMIS just to confirm what folks will see.
Okay. Will choosing a CCOF be an option during the application? Well, I think we should keep going and maybe flag some of these questions for at the end. I'm not sure if that one is going to be answered. Why don't we just answer this one and then we'll keep going. Will choosing a CCOF be an option during application like a CCOA is? We actually do cover that. All right. Let's see.
Okay, so to revisit the MMIS question, just to clarify, I got some information. So on January 1st, everyone with user access to the enrollment panel will see an additional enrollment option for CCOF, just like we see CCOA, B, E, and G today.
All right.
Okay.
Let's keep going, then we'll circle back to some of these questions.
Okay. Okay, so as I mentioned, so folks can till the end of the year call client services to choose which CCOF dental plan they want to enroll with if they're in a county where there are multiple CCOs. So that's about 34,000 people. If they don't make that selection and we randomly assign them, and then they decide later they want to change, or even if they do make that selection and they still decide later they want to change, they can do that. And here are the opportunities for them to do that without cause, meaning they don't need any other reason besides I want to change my plan. So they can do that within 90 calendar days of that initial CCOF enrollment. They can also do it 6 months after 6 months of enrollment with that CCOF. They can do it during the OHP eligibility renewal window. And then if none of those scenarios above can be applied, they have one more opportunity where they can change their CCOF plan. But it needs to be within their eligibility period, which is typically 1 year. There are other reasons with cause that where members can change their CCO enrollment, and that's highlighted in the Oregon Administrative Rule link that I provided there. There are lots of scenarios, and I didn't know if we'd have time to get in the weeds for them or if it was necessarily that relevant for this particular presentation. But if they change service areas, so if they move counties, of course, that's a reason with cause to change CCO enrollment. So if you have more information, you can definitely check, or want more information, you can definitely check out that link. Okay, member communications. I mentioned this briefly earlier. We did send out notices to most of the 69,000 folks. We still haven't sent them to the Tillamook County residents because we're doing some data analysis there on figuring out which providers which members will be able to keep their providers. So Tillamook County has not received notices yet. That's about 500 members. But most members have received notices about this change. They received them earlier this month. As I mentioned, we're going to send the Tillamook County notices early in November. And also, we're going to be doing another mailing next month for new folks that have enrolled with DCOs. So we have seen about 3,000 new members come in onto DCOs since we sent this letter in early October. And so none of those folks will know about this transition. So we're going to do one more mailing for them next month. So in terms of member action, they're not required to take any action. If they want to choose their CCOF and they're in a county that is served by multiple CCOs, they can certainly do that. But if, like I said, if they don't pursue a selection, then we will randomly assign them based on the dental care they receive today, so that we can keep that provider-member relationship intact. And that is our priority, for members to keep their current dentist. More about the member communications. There were 4 letters that went out that basically mirror the 4 scenarios for members. The first one was where there's one CCO serving the county, and those members won't have any change in their dentist, their provider. They'll move into the CCOF that's available in that area, and their CCOF already works with their current dentist or their current DCO. So really, there'll be no impact to the member other than they'll receive this notice of who's now managing that relationship with the DCO. For 34,000 members, they received the choice letter, and that's where they live in a county where there are 2 or 3 CCOF options. Again, if they don't pick one, we're going to assign one, but there are plenty of opportunities for them to change if they decide to later do that. The 4,000 again that have a change in dental provider, they reside in a county that doesn't have a relationship with their current DCO, and I mentioned what those counties were. So they've received this letter letting them know that. They have until March 31st to wrap up any current treatment or care with their dentist while the plans work together to move their care. And then 1,600 tribal members received a notice with a message that they'll not be moved to a CCOF automatically. So if they want to be in a CCOF, they can call CSU and request that. And CSU is Client Services Unit. Okay, so will CCOF options show in applicant portal? So the CCO selection in applicant portal AP will not change. The clients will be able to continue to choose a CCO preference. And then if they're eligible for CCOF, they will be given that CCOF choice. And then dental plan options do not show as choices in applicant portal. Okay, so who may be enrolled in a CCOF plan type? So we know that some people will be auto-enrolled into a CCOF. Those are individuals with medical TPL that does not cover dental. Individuals on the new COFA or Veterans Dental Program will also show up in CCOF plan type. And then others can opt into CCOF by calling client services. That would be Medicare members who opt out of a CCO. And then again, the tribal members on fee-for-service may choose to be in a CCOF, but they would need to opt in. They will not be auto-enrolled.
We do have a question here, Jesse.
Okay.
And it's that, and I think it's something that somebody else mentioned too. So I really want to call it out, even though this particular question is county specific. I'm wondering if it's happening in other places. Many members are on open card currently and enrolling into Advantage. And this is specifically, this particular question is about the Yellowhawk tribe, from folks who are with the Yellowhawk Tribal Health Center. Many members are on open card currently and enrolling into Advantage. I'm wondering if on the horizon, this means that I will be potentially need to be assisting them in enrolling back into fee for service with this change. So I think what I'm hearing is that there are some, are we expecting any changes for those who are on fee for service dental right now? And maybe that's the first question.
So if they're on fee for service because they have an exception or an exemption, we will continue to reevaluate the exemptions and exceptions, and then they will be able to remain in fee for service if they're eligible. For folks that are on fee for service because there is no CCO capacity in their county, or a CCO doesn't, there's no CCO option in their county, and that's why they're on fee for service. The system continues to evaluate those members, and then we'll move them into a CCO if there are no barriers. In terms of tribal members, though, if they're enrolled in Advantage Dental DCO, that should be because they opted in to be enrolled in Advantage Dental. So then what will happen before the end of the year is they'll be moved to fee for service, and then if they want to opt back into to be covered by Advantage Dental, they would need to opt into the CCOF. So Yellowhawk, that would be Eastern Oregon CCO, who does have a relationship with Advantage. So they'd be able to enroll with EOCCO, CCOF, and keep their provider that they have with Advantage. Does that answer?
What I'm hearing then is the expectation is that people, like, let's take Yellowhawk, or in Umatilla County, people who are tribal members in Umatilla County who are on a DCO right now will actually the tribal choice has been for them to be on fee for service through this change and to only enroll in that CCOF upon an opt-in request with CSU. Is that correct?
Correct.
Okay, just clarifying. So we shouldn't not see tribal members enrolling into a CCOF unless they've requested that.
Correct.
Okay, just clarifying.
Can I add, just to make sure that it's really clear, for tribal members that are wanting to opt into a CCOF level, please be aware that you cannot select that through applicant portal, because the only option you're going to have through applicant portal is a full CCOA selection, which will enroll them in all of the medical, pharmacy, doctor, all that stuff. So in order to get just the CCOF level and stay fee for service for medical, for instance, that has to be called in separately.
Thanks, Christy.
That was an important clarification, yes. Okay. Whoops. And let's talk about some resources, and then we'll wrap up with the extra questions that we have.
Okay. So a resource guide to help members find their new dental plan or to learn more about which dental networks have relationships with CCOFs. We've put together this resource here, and it really reflects the CCO comparison tool that's already out there on the website. So this is just a different way to look at that information, and it's organized by county in alphabetical order, so it's more member centric to look where they reside, which county. They can look over and see which zip codes are covered, and then what their CCOF option is in that county, in that zip code, and then within that CCOF, which dental networks have a contract. They can look at that. So I'm looking at the first line for Eastern Oregon in Baker County. They have a relationship with ODS Community Dental. So any of those DCO members that are currently with ODS Community Dental, when they move over to CCOF for Eastern Oregon CCO, they should have a pretty seamless transition, not lose their current dentist. If there are questions though about which providers each CCO has in their network, we've provided a link there to the provider directory for each plan, and they can take a look at that. I do want to put the disclaimer out there that this resource, we did attach it with the webinar materials. It is in current draft form, so it is a draft. It's pretty close to being finalized, but we are giving our DCO and CCO partners some time to review it and report any updates to us. We want to make sure that it's accurate with the latest information. So it is in draft form, has a watermark draft on it. We do plan to finalize it by the end of this week, and then we can share a final version of it the end of the week.
Right, we do have a variety of resources, but I want to spend the time, instead of going through those, answering some of the last minute questions that we have here, that we have flagged. So Jesse, here is the first question. Sorry, we already answered that one, so now moving on. Will we be able to see the DCO in PH Tech?
That's a David Ballantyne question, and my colleague is not here, so I'm gonna have to take that one back because I'm not sure what PH Tech.
No problem. Next question. Will MMIS just say what their CCO is, even if it's just dental? And I think people are trying to gauge the level of confusion. So if somebody's on fee for service for medical, but they're enrolled in a CCO for dental, will they be able to tell that it's just that CCO when they look at just that CCOF when they look at MMIS?
Yes, they should be able to see the enrollment level being CCOF plan type.
So we'll actually say CCOF.
Yes.
Great, thank you. I do not hear, I don't see any other questions. I see some statements. One of them, I'm actually not sure if it's a question or not, because I don't understand it, and I apologize. So I'll read it. In order for them to have a referral fulfilled, they have to request to be enrolled in Advantage. And that's really, I believe, about folks being seen through the Umatilla, the Yellowhawk Tribal Health Center. Do we know anything about maybe
To
we
be
can
enrolled
follow
in
up about
Advantage, they
that.
have to have a referral. Is that what you said?
In order for them to have a referral fulfilled, they have to request to be enrolled in Advantage. Is that? And I'm not sure if it's a question or a statement. I'm wondering if you can interpret it, and if you know more than I do.
Yeah, can whoever ask that or put
I
that in,
think
can they expand on
I'm
that?
going to make the call to take that one offline to go a little deeper. We'll have one more question here, and then we're going to wrap up. How will we be able to know which dental or dentist patient is enrolled under a CCOF? I think you can look in MMIS, and it will say CCOF for that individual. But it's unclear if they're on open card for dental, if they remain on open card for dental, what that will look like in MMIS. Can you speak to that, Jesse?
Let me add I received some additional information. So there are new region codes that are created for this new coverage type. So there will be new region codes in MMIS that will lead with the character F. I wish I had a screenshot to share. Maybe we can follow up with the screenshot if we have other questions we want to follow up with.
All right.
But, so what was sorry, I know I didn't answer the most recent question.
That's
still,
okay. It's time, so I just need to call us for time, and we can follow up with any additional questions. But hopefully this has been helpful, and we're all learning what this is going to look like as we go forward. So if you have additional questions going forward, please feel free to reach out to your regional outreach coordinator, and we will call on Jesse to help us get that information out. But I will send out the 3 handouts that are in the webinar as a follow-up, and we'll take a couple of these questions offline because they're a little deeper, and I want to thank everybody for being here. Definitely want to thank Jesse Wilson and Christy Taylor and Crystal and Franklin for all of their contributions, and I hope everybody has a wonderful Wednesday.
Thank you.